Thank you.
Thank you.
And I'll also bring my own timer and try to keep on track. I will, in the issue of full disclosure, just mention the fact that I am a public health practitioner trained and in action most of my life, and this is my great passion. So there is an underlying bias in my presentation in favor of public health. So first, I just want to begin with an acknowledgement that public health, whether it be state, local, national, has an awesome burden and challenge ahead of it. One, the major challenge is to address vulnerable and high-risk populations and communities. Note the actions, and I just listed out the various actions from the 10 essential services of public health services, and these are the action words. There's an incredible agenda that public health is expected to accomplish. When we look at the middle lines here with health promotion, health protection, environmental health, you see that the subject areas are profound and very, very varied at the same time. And underlying all of this is the mandate for workforce training and development. So the challenge ahead for public health has long been and will continue to be an incredibly difficult step. And so we in health literacy research, whatever field we might align ourselves with, really owe it to public health practitioners not to offer an additional mandate, not to offer additional work to do, but indeed to look at how we can integrate health literacy insights into the work that is ongoing and that is essential for public health. So the role of health literacy, when I ask, is it an added burden or fit, we need to consider our applicable research findings. What have we learned that public health can take in and do? Is our focus appropriate, and what can we researchers do to broaden our focus, perhaps to aid and assist and facilitate public health? And how can we become partners for integration and expansion? So when I talk about insights from health literacy studies, I'm being relatively superficial, just giving you the headlines, yet acknowledging that there are profound lessons that are worthy of attention and that can be adapted by the public health community to change and modify, adapt as needed, but to influence their work. So we know, these are the facts that come out. We know that there is a link between patients' literacy skills and health outcomes. Well documented. We know that access to information has been hardened in some way, has been made more difficult. There are barriers that are unnecessary barriers with access to information. There are difficulties in regard to health professional actions and steps that professionals can take in a variety of realms, including writing, speaking, and the oral exchange that takes place. Healthcare environments erect unnecessary barriers as well. Now, again, these are insights from research that has been done over the past 15 years in health literacy, and we can think about how these insights can be used in public health studies. So again, the research findings about limited literacy linked to health outcomes, these particular consequences, there are others of course, are resonant with the public health mandates as far as participation in health promotion, disease prevention, and screening activities, part and parcel of public health activities. There's a differential ability to manage a chronic disease, and many of the chronic disease information and help and assistance for communities is part of the public health mandate. There is overall increased morbidity and mortality, and this speaks very, very clearly to issues that relate to disparities. We know, too, that there's a mismatch between health system demands and population literacy skills, and those consequences are profound. Again, addressing issues of profound disparities. There's limited access to information. There are barriers to services and care, and difficulties navigating health institutions as well as social service institutions. Of studies underway here where we don't have absolutely clear outcomes documented yet, but this is a field that's growing. We've been more attentive recently in health literacy studies to the listening and speaking skills, both of patients and also of professionals, and how that interferes with the transfer of information and dialogue and discussion. We're paying a lot more attention just in the last 5 years to issues of math. That's just not just computation, but it's also mathematical concepts. And of course, we in public health are using mathematical concepts all the time. Very difficult concepts such as normal and range and the word risk. We talk about risk all of the time without really paying due attention to the fact that it is a profound mathematical concept and we need to do more to explain it. We're beginning now to pay more and more attention to institutional characteristics and the barriers that they might erect, not just in healthcare, but in social services, and soon as well, we hope, to public health institutions. There are tested approaches that we have. There are tools for the development and assessment of information in print and online. And we have, of course, one of the preeminent scholars in our audience, C.C. Doak, who helped develop those tools and the articulation of how we pay attention to language and organization and structure. But more important, the procedural issues of formative research and piloting, the importance of working closely with members of the intended audience. We have techniques for improving interpersonal exchanges, documented and tested, question asking, teach back, decision aids. We've long known of the value of increased participation and engagement, mostly through health education, but also more recently in decision making and action aids. We know, insights from health literacy study again, that there is needed change that has to take place. We cannot afford to simply sit back and wait for the educational sector to educate the public and improve literacy skills. People, indeed, we look at morbidity and mortality statistics. People are unnecessarily dying too early. And we can step in with this disparity and we can make a change by lowering demands. We can lower demands by looking at our work in print, online, for speeches. We can look at professional education and training. We can make changes in institutional norms and demands. And we can apply assessment tools that do exist and that we need, in a sense, further development. We don't have very good assessment tools as yet for labels, for data gathering instruments, or for media messaging, but we can develop these over time and we can add to the toolbox for people to make important change that has to take place. So with these lessons learned, that we can take action to enhance health literacy by focusing both on improving individual skills and changing systems. We know we have an instinct, but we also have documentation about what makes a health literacy environment friendly and easier to navigate, and we're beginning really to code that very carefully and to focus on that more. So the question is that if we've learned this, within the context of our research in health literacy, can we apply this and is there a fit with public health? So first I say there's a very strong fit with public health at the very beginning for the theoretical foundation. The very focus of public health really is concerned in the interaction between the environment and societies. Epidemiology is founded on the notion of the reciprocal relationship between persons and environment. We draw very heavily on the social ecological model. In public health, we do not focus ever on the individual or even the family without acknowledging that they are embedded within a very complex environment that has to do with institutions and agencies, with the physical environment, with communities, with workplaces. There were too many that would make my little graphic here look absurdly complex. But that notion of embeddedness with multiple levels of structures and social and physical environments was always and has always been an important aspect of public health. So the fit is very good with health literacy here. The fit is very good indeed with another level as well, with the public health mandate to address vulnerable populations. We know a lot of this information from the adult literacy surveys that took place in 1992, that took place in 2003, that took place again in 2012. People with limited literacy are very often in triple jeopardy squared. They have limited literacy, which means limited access to information, limited ability to navigate, to be engaged in civic activities, limited employment opportunities, limited income, diminished social status, and a real sense of marginalization, environmental exposures, people who are poor, people who tend to be in low literacy families, may also live in poor housing stock, areas of environmental degradation, get employed in institutions and companies where there are hazardous work environments. They then have limited resources or social capital and diminished collective efficacy. So all of this is well documented for us. So that overlap between a focus on the issue of literacy as a social disparity and public health mandate to address people who are vulnerable populations and vulnerable communities is a very strong fit. So we also have a fit overall with the public health mandate to reduce disparities. Now, in order to do that, we have to think about workforce development. We have to think about reducing barriers to information. We have to improve our data collection, and we have to focus on how we better enhance partnership development with attention to literacy. So it's not adding to the list, it's simply highlighting ways in which health literacy can truly facilitate the work that lies ahead. So apply health literacy insights into essential public health services. This is the graphic that's used to really illustrate the mandate of public health. And I would argue that we can think about enhancing each of these activities with public health insights. So first, we have to think about expanding the context, where people live and work, and everything that public health pays attention to, the social and the physical environment. Now, I just want to use an example here, thinking about a health context as a metaphor. A lot of our work in health literacy has really come out of fine scholarship, most of which was based in hospital settings. Now, in using this as a metaphor, I'd like to just engage in a small exercise with you. I don't know, some of you may have seen this. It's a connect the dot exercise. If you want to just sketch out these 9 little dots in 3 columns and 3 rows, do that for a moment and see if you can use only 4 lines. Don't lift the pen from the paper wherever you start. 4 connected lines to connect all of those dots. See if you can do that very quickly. I have only 2 minutes left. I didn't see the first 5. So I impose parameters by giving you that graphic in the back. Let me show you that you have to go outside the box. And health literacy has. We've looked at self-care and maintenance and actions that people take at home for themselves. We've expanded, and we need to expand even further, the health settings. So we've looked somewhat at health and social services at home, at work, in the community, in the policy arena. We have to look at a variety of health activities, not just maintenance in healthcare, but promotion, protection, prevention, systems, navigation. And indeed, these are the public health contexts. And these are the different topics where many of us in health literacy work and research have not yet ventured. And we need to form partnerships with public health so that that we can bring a public health perspective to work in water quality, in emergency response, in civic engagement, and really focus on those issues that are the heart and soul of public health. So public health literacy, an interdisciplinary field, has always been concerned with social organization and a culture that promotes and supports the survival of the group. So we have to think, how can public health move ahead to remove literacy-related barriers and continue to support and encourage the capacity of communities? So here, I give you we've been playing with definitions of terms. This came out with Don Nutbeam, who really pushed the agenda the furthest these days about definition of terms. But here we might look at the policy and communication skills of health systems and health professionals that support and encourage the engagement of people. The public health challenge ahead, indeed, is to implement in training, to integrate, that's my timer, and I'm at 0. I have just 2 more slides, I think. To integrate and enhance communication efforts, to develop and monitor health literacy components. This is a cry out for wonderful partnership, and it perhaps